On the Medical Watch this afternoon, creating a life while saving a life.
Medical reporter Dina Bair has more on preserving fertility during cancer treatment.
Treatments can be toxic and can render many women infertile, but there is hope, and that gives doctors and breast cancer patients a reason to smile.
I remember thinking how lucky I was to be in that position where I was offered that moment.
Do you know what you're doing today?
Yep.
Now it's moments like these, holding her 2 children, that make Gudrun Wu-Snyder feel lucky. Diagnosed with invasive ductal carcinoma, she underwent a bilateral mastectomy and began a course of tamoxifen, a drug that dampens estrogen in the body.
It wasn't on my top of mind whether or not I was going to have another baby. On top of mind was whether or not I was going to live.
But it was on the mind of her care team.
We know that when fertility isn't brought up initially at a cancer diagnosis, there's a lot of regret that goes along with that for these patients and survivorship.
Advocates want patients to know their options that include a wait-and-see approach with the hope some residual fertility is maintained, medicines that put ovaries in a menopause-like state to help preserve egg counts, though data behind the technique is mixed, and egg and embryo freezing.
This is a process where we put a patient through an expedited in vitro fertilization cycle. It takes about 2 weeks from start to finish. It's not cycle dependent, so we can really get patients in quickly, get them through quickly, and then get them back to their treatment as needed.
For Gudrun, it was the best course of action. Before starting drug therapy, she underwent an egg retrieval and ultimately froze embryos for later use. About 1.5 years into her treatment, her doctors allowed her to take a break and try for another baby.
I think just being able to have the opportunity to try for a second was a really, really big gift.
It's a gift pediatric doctors are hoping to offer even younger patients through ovarian tissue freezing.
There are researchers really all around the world and actually just across the street at Lurie Children's where they're really actively working on ways that we can isolate out follicles from that tissue and then grow those follicles outside the body so that we can get a mature egg.
I think it's so important to be your own patient advocate. So if there's anyone out there who's like watching this now, who's thinking, I'm going through my own cancer treatment, is this something that I should be thinking about? I think it's so important to reach out, ask your doctors, see if you can find a program like that.
Insurance coverage for medical fertility preservation varies state to state and can be costly. Here in Illinois, services are covered. Back to you.
And you can join Dina Bair and Dean Richards this Saturday at 6:30 p.m. for WGN's Stories of Hope, Facing Breast Cancer. It's a half-hour special that will explore a variety of topics for patients and their families, everything from nutrition, artificial intelligence and its use in mammography, plus an experimental vaccine.